Beauty is when you can appreciate yourself. And when you love yourself, that's when you're most beautiful. And if you can appreciate yourself and make friends with yourself, you'll never be alone.
The Via Mia Show is sponsored by the following people.
Recording, rehearsal space, voiceovers, video editing in Westminster. For more information, fiascobros.com. Cuts and colors in Uptown Westminster. We welcome our stylist, George of Salon Caliente. For appointment, call 604-544-5104. Private investigations, security and alarm systems since 1972. For more information, call 604-251-2121. Makeup services for television, movie, and photo shoots. For more information, visit victoriawan.com.
Probably wondering what was that brief intro about. You'll understand shortly. Lots of questions and answers are coming up. Via Mia today, the topic and field that's never been brought to the show. I would like to welcome plastic surgeon Dr. Peter Lennox. Hello, Peter.
Hello.
Very nice to have you here.
Thank
you
you
have
for
no
having me.
idea how many years I was waiting for somebody of your caliber to enter this place. Well, you were here, you were listening to me at the beginning, what I was saying in an intro about beauty and the confidence. Do you really agree with me that how we present ourselves, how we feel about ourselves, that reflects on our behavior or performance?
I think that's true, and there's actually studies that have been done on plastic surgery patients that reinforce that there are a number of people obviously have surgery for different reasons, but there are a lot of people who plastic surgery is a very positive thing and does give them more self-confidence and makes them more comfortable with themselves.
Yeah, I do believe that. You know, when we look at ourselves and we see something we always wanted to see, it really reflects, it shows on our behavior. And like you said, you're one of those who helps us a lot. Now, because we have only half an hour, and then half hour, unfortunately, has only 30 minutes, and I would like to give it to you all, so I'm going to let you speak more than I should. So I want to say, I know you're excelling on three major parts that generates the interest in your profession as a plastic surgeon. It's face, then I think you said body contouring.
A lot of breast surgery and then body
surgery
contour.
and tummy tuck.
Yeah.
So now, in like general, to start, before the surgery comes, you offer consultation, which I think is a very important part.
Yeah, I think it's probably one of the most important parts because that allows me to find out information, first of all, medical information about a patient. Are they safe to have any kind of surgery? To find out a bit about their goals and objectives and their motivation for having surgery, and then to assess what kind of surgery they would potentially benefit from and see if we can put all those things together. Because sometimes not everybody is a candidate for surgery, and sometimes the surgery that people think they want is not necessarily what would give them the best result.
Yeah. Since you had so many patients going through your door, what is the major interest or concern of your potential patients?
It depends on which one of those areas you're talking about. So for facial surgery, a lot of people, the most common thing people will say is that they look in the mirror and the reflection that they see looking back at them isn't how they feel inside. Most of us still feel younger than we sometimes look, and people don't want a huge change, most people. They want to go back to feeling the way they feel inside or looking the way they feel inside. Breast surgery, a lot of the times in cosmetic breast surgery, it's the same. It's women, a lot of women who've had children, had pregnancy, and they want their breasts back to be a bit more youthful to the way they were. And then I do a lot of breast reconstruction after breast cancer, and for those women, that's a different process and a different goal. That's to feel whole again. And then body contour surgery, again, people sometimes, their body changes either because of lifestyle, weight gain, weight loss, pregnancy, and they want to get back to something that they feel more comfortable with.
Mm-hmm. So you're learning about each other, same like you want to know. I mean, they want to know what they can expect and their concerns are covered, but you also, like you said, you need to know about them, what they are looking for, what they want. Have you ever turned down the patient?
Yes.
That was pretty fast.
Well, I mean, sometimes there's some patient who their goals are not achievable. There's some patients that personality-wise, you're just not a good fit. So there's some people that would be better off with a different surgeon because they might interact better. So if I'll quite honestly tell a person that I don't think I'm the right surgeon for them, or that I can't deliver what their goals are.
Mm-hmm. So yeah, I noticed that you're very straightforward. You will tell them how the things are, and yeah, that can prevent a lot of potential problems in the future. Right? While you're looking at
for both of us, yeah.
You've probably been there, right?
Yeah.
So you know, yes, exactly. So why don't we start? Right, I'd like to start from head to toe.
Sure.
So let's start with face. Now there's face. It's facelift. You do what else?
So we offer surgical and non-surgical. So for non-surgical, things that you've covered before, Botox, fillers, facial skin care. And then surgical, it's brow surgery, so repositioning somebody's brow, eyelid surgery, lower eyelid surgery, and then facelift surgery. Those are the most common facial things that we do.
Mm-hmm. So do people come for just certain one, or you do the overall, or what does it
sometimes people will come and say, I look tired and my eyelids are bothering me, and then we'll talk about that. Sometimes people will just want to know what all of their options are, and so when I assess somebody, even if they just come about one thing, I'll tell them other things. So I'll start from the top and go down, from their brow right down to their neck, and then we figure out what is the best solution for them out of the things that I see and that they see.
Yeah. You know what I was wondering, if you do facelift, I mean, the person when it wakes up, not right away when they wake up, but of course the face looks refreshed and looks youthful. But the changes like rhinoplasty, which is nose surgery, that changes the character of the face, right?
Yeah.
How do you prepare the patient?
Most of the time, I think plastic surgery has changed over time. So I think the era of very, very tight or overdone plastic surgery, most plastic surgeons try to avoid that now. And the goal is that somebody should look exactly as you said, refreshed, more youthful. Yeah. You're sort of setting the clock backwards. People shouldn't look weird or strange. There are some things that we do if you add a lot of fat to somebody's face, for example, with fat grafting, that you can make their face look different, and you have to have that conversation with the person up front.
So there are no shocking experience when they look at themselves, that somebody else is looking at the mirror and suddenly... No,
it's very rare.
Well, you prepare them for everything. So we don't only speak. I know we have some pictures, because I'd like to see something from to compare the face surgeries if we have. So this is facelift. Yeah,
this is a lady who was in her late 60s who wanted some, again, subtle changes. So she had some sun damage. Where a lot of people notice as they age is in the lower part of the jaw and in the neck, and that's what she wanted. That was her primary goal, is to have that rejuvenated and lifted, and so she's had that done. And I think on the side view you can see that loose skin that goes into her neck, and on the side of her jaw is much smoother. It's a much better contour, and she looks more youthful and more refreshed without looking, she still looks like herself.
Exactly, yeah, exactly. It didn't change her at all. So this is what can be damaged, we see it on the left, by sun? This is by the sun? This
is a combination of age, sun damage. Those are the typical things. And the big thing that we don't have control over is genetics. We all age very differently depending on our genetics.
Yeah, exactly. That's what I always thought. The genetics, genes are number one.
Yeah, it's a big thing.
And then we can talk about creams and all the stuff on our face. You stepped into something. Yes, we had a Dr. Jeffrey, who you know injecting Botox here as cosmetic He's concentrating on non-invasive rejuvenation. You said that you do that as well in your clinic.
Yeah.
Do people still go to see you? Because I know that your major thing is the plastic surgery.
A lot. And I work with an excellent nurse injector. Her name's Daniela Pinka. And so not everybody wants surgery, and it's a very nice combination. So I'll see all the patients up front if they are interested in non-surgical rejuvenation. And a lot of those patients at some point will get to a point where they want more than you can get with Botox or fillers, and then they need surgery. And so they're already in the right place. So we see a lot of those patients, and the patients quite often flow back and forth. So I'll see patients who want facial surgery, and then I'll get them to see Daniela for skin care and things like that afterwards.
So let's say that you have a patient who comes to you for just cosmetic surgery, for non-invasive rejuvenation, and now you see that this is not going to work anymore, and it's time to step further.
Yep.
How easy is to say it to somebody who...
It's pretty easy. Most of those people are interested in the way that they look, and most of them already have a sense of knowing that. They'll look and see, okay, I've achieved a lot of things with Botox or fillers and skin care, but they'll say, I still notice this or X, Y, or Z, and I'll tell them the only way to change that is surgically. And then they can make a decision, let's explore that, or no, I'm not interested in surgery, and that's fine, I'll live with it.
So I'm sure that the age is not that indicator when it's time to step into that. Like you said, it's genes, right?
Yeah, everybody looks different at different ages. So there's some people in their 40s who are going to be better with surgery than skincare.
So, well, I think that for the face, that would be it, because I'd like to step to the other part. Like you said, nose work. I have to tell you, when I was little, I was growing up in a completely different culture in Eastern Europe. You know how kids can be very mean.
They're mean here too sometimes.
Whole school was laughing, really,
Yeah.
laughing about my nose. And I was telling to my parents, well, one day when I'm big, I'm gonna change my nose. I don't want to have this every day in the school. They were laughing at my nose. And my mom looked at me one day and says, you know what, they're right, it's pretty funny. So, and I grew up, I don't care anymore, I was thinking, I think that I would worry that it would change me completely, even though that I saw people with beautiful, beautiful job. I think that I'm going to leave it for now. We're going to step in a short break so we can be back with Peter Lennox right after that, talking about the rest of the topic.
The VMEA Show is sponsored by the following people.
Recording, rehearsal space, voiceovers, video editing in New Westminster. For more information, fiascobros.com. Cuts and colors in Uptown New Westminster. We welcome our stylist, George of Salon Caliente. For appointment, call 604-544-5104. Private investigations, security and alarm systems since 1972. For more information, call 604-251-2121. Makeup services for television, movie, and photo shoots. For more information, visit victoriawan.com.
So we are back with Dr. Lennox. You had it right on the screen. I forgot to mention the website where you can hear, see more, and read more. It's dr.peterlennox.com. And we were very briefly covering your face work, surgery, and what we can expect. Now, moving a little down to tummy tuck, that's what I was interested to know. That part I heard so far the least. I know there is also something that people call liposuction. There are two different things. So tummy tuck versus liposuction.
So there are two different techniques, and a lot of times we combine them. So liposuction is simply removing the fat out of somebody and letting their own skin tighten up. So that works in areas where people have good skin tone, younger people, their skin tightens up really well, small amounts of localized fat. A tummy tuck tends to be more where you have a lot of excess skin or fat, or where you have to tighten the muscles in the abdomen. So the typical tummy tuck patient is somebody who's had children, a woman who's had children, or somebody who's had a significant weight loss and they've got lots of extra skin. So you can remove that skin and fat and then tighten up their muscles at the same time. And we use liposuction as a tool in those people to help get an even better contour as well. So
these two procedures usually done together?
Liposuction can be done alone without any other incisions. A tummy tuck quite often involves liposuction as well.
Yeah. I don't understand, like I said, this feels so, I'm going to ask this question, maybe sounds strange, but after liposuction, can the body fat start to accumulate in different parts of body?
It can, in the sense that when you do liposuction, those fat cells are gone. So in that area, there's much less fat. If somebody continues to gain weight, your body will put that weight on somewhere. So in the areas that you haven't had liposuction, they can get a bit bigger.
Okay, so it won't go back to...
It won't go back to where you took it from, but it will. Your body will put fat on somewhere.
Okay.
So ideally, if you're going to have liposuction, you should stay the same weight afterwards.
Okay. Or I have to look for you again so you can remove the fat from my legs, for example. Yeah, I've heard about this, but it didn't make sense to me. I really didn't understand why it wouldn't go back where it was. So now
those cells are gone.
Yeah, I know. I know we have some pictures about this as well.
Sure.
So maybe if we can look at the tummy tuck.
So this is
tummy tuck?
Yep, this is a tummy tuck. So this is the before and after. This is a 43-year-old lady who had one pregnancy and gained quite a bit of weight with her pregnancy and then lost quite a bit of weight. And so she had a tummy tuck done where skin and fat were taken out, and then she had liposuction at the same time, and her abdominal muscles were tightened up as well. So you can see on this view her whole sort of thickness is much less, and that scar is well hidden underneath her underwear or where a bathing suit would be.
It looks actually good. It looks like she's been working out all her life. Like very, very toned, I would say, very toned. Yeah, it's like I can see so far that from the images you're not overdoing things. Like you said that.
Try not to. Yeah.
So you still look natural, right?
Yeah.
In terms of surgeries in general, I know this is going to be individual. It's not the answer for the same for all the parts, but how long approximately the surgery lasts?
Well, for surgery, breast augmentation is different because you have an implant there, so we can talk about that separately. Yes. But most surgeries, the result is permanent and then will change slowly over time as you continue to age. So for somebody like that who had abdominoplasty, unless she gains a lot of weight, she'll never go back to the way she was. Her skin will loosen up a little bit over time, but it should never go back to the way it was. Facelift surgery, it should last you 10 to 15 years, and then some people have a revision at that point.
Yeah, well, when you're talking about the facelift, I wanted to ask, I know that with the Botox fillers, we already know that doesn't last very long. Is there any expiry date with the facelift? How do we have to look after our skin after?
It's just the same things we tell people who haven't had facelift. So sunscreen, good skin care. There's different things you can use on skin depending on your skin. But all of those same things, you are still going to continue to age from the point of the facelift. So usually 10 or 15 years later, you may have had some signs of aging again.
Now, why don't we move to the last one, because that seems to be probably the most, I think it drags the most interest, the breast surgery. And what I was reading on your website and all over the net, because you're all over, I saw they are dividing what you do, breast augmentation, which is breast implants, breast lift, breast reduction, breast reconstruction. So why don't we start with the breast augmentation?
Sure.
We have some pictures right now.
So this is a woman who, again, she's had a couple of children, and she's sort of typical of the average patient that I see. Doesn't want a huge change. She wants some more volume in her breast. She wants some upper pole volume. And so she has implants under the muscle in her case, and has a result that she's very happy with. She's got a more youthful breast that still matches her body and looks proportional and natural.
Even from the side, okay.
And
That's the same person?
patient, yeah. And so that's the type of result, and that's probably the most typical patient I see, is somebody who wants not a huge change, but wants to be able to look feminine and not have to wear a padded bra.
Yeah, you said that the implant was inserted under muscle. There is another.
Yeah, so you can either put a breast implant on top of the muscle or under the muscle. When we say under the muscle, that usually means partially under the muscle. So in the lower part of the breast, the implant's not completely under the muscle, and that allows it to have a nice natural curve in the lower part.
So you would recommend this particular procedure more?
No, I do both, and it depends on the patient's anatomy and their desires. And so that's something when we talked about earlier, the consultation, I go through all of the different options with patients and figure out with them which placement on top of the muscle or under the muscle is best for them.
When we talk about breast lift, what does the surgery look like? What do you do?
So breast lift tightens up the breast skin. So in somebody who's had pregnancy or just with age or weight loss, the breast can droop and the nipple can end up low on the breast. And so the goal of breast lift is to tighten up the skin and bring the nipple back up to a much better position. A lot of times that's combined with a breast implant to add volume to the breast as well.
Yeah, both together. Breast reduction, we know you have patients, I think that I saw some pictures, maybe we can take a look at them. They're the patients that they don't want to carry that weight, obviously, after few children. I don't know what would be the reasons.
Yeah, it tends to be weight and heaviness over time.
So now, for example, is this?
No, this
is breast reconstruction. Okay, so we don't have anything. So let's take a look at this breast reconstruction, because a lot of people don't know what it really is.
Right, so breast reconstruction is making a breast after a mastectomy, and there's lots of different ways of doing that, and we do them all here. This is a lady who had breast implants in, and unfortunately we can't show her nipples, but she's had nipple-sparing mastectomies, which is a newer technique. So in one operation, she's had her mastectomies done and implants placed and saved her own nipple. So the only scar she has on her breast is that small scar you can see on the side. And she's got a good aesthetic result, and her breast cancer has been treated as well.
So that's amazing how you can, I don't understand how that's the only scar you see on the side? Wow.
Yeah, so her whole surgery's been done through that scar. And so there's lots of different techniques. You can use tissue from somebody's abdomen, you can use breast implants, but there's a lot of options for women who have to have mastectomy.
Wow. I don't understand how the technology, and I saw when I went to see you at your office, you were showing me one of your programs, the 3D, that you can actually show people what they're going to look like.
Yeah.
This is amazing. And while we were talking about is looking at the table right now, you brought different kind of implants. Can you please?
Sure. So this is sort of a sample of the different types of implants that are available in North America. So this is the sort of traditional saline implant, which has a silicone shell and a fill tube, and it's filled with sterile salt water in the operating room, and then you pull the fill tube out and leave the implant in, and it's filled with salt water. And then these three are silicone implants. So this is a smooth silicone gel implant, similar shell to the saline implant, and it's filled with silicone gel, which is much thicker than the old silicone gel implant. So this is what's called cohesive gel. So you could cut this implant in half, and the gel wouldn't come out.
Oh, really? Wow.
So they're different than the old ones. This is another silicone implant. So this is a textured silicone implant. So same idea as this, a silicone shell filled with silicone gel, but it's got this rough surface, which is thought to decrease capsular contraction.
Why is it different surface? Because nobody's going to see that surface.
Right. One of the thoughts with, one of the main problems with breast implants is capsular contracture or scar tissue forming around the implant. And it's thought that this may decrease that. There's some studies that show that, but it's a bit unclear whether that really happens. This is a shaped implant, so some people, when they look on the internet, hear about a teardrop-shaped implant or a shaped implant. And so this implant from the side has a shape to it. that you can see that looks like a breast. And because it has that shape, it has to have this sort of surface so that if it ever rotates, it's designed to stick in place.
Yeah. I don't have much time, but I would like to at least ask one or a couple questions what I got from outsiders. They knew they're going to be here, maybe one. Somebody asked, can breast implants burst or alter shape if they are squeezed too hard?
Very unlikely. So all of these, the silicone implants and the saline implant, have a failure rate, so a chance of bursting of 1% per year, roughly. So it's very, very low with the new implants, and just squeezing them won't do that.
Okay. Would breast implants bring more awareness to cancer?
That's a really good question. There are some studies, and you can imagine if you have an implant pushing up on the breast tissue, it makes any changes in the breast easier to feel. And so there's some studies that suggest that women who have breast implants find breast cancers earlier because they can feel them because they're pushed against the implant.
Yeah.
It's a bit unclear, but there's certainly no evidence that having an implant increases your risk.
Yeah, and there are also things like I wanted to talk to maybe very briefly about mammography, because we know, at least I took the kind of research that in BC there is no way that women with implants can go through ultrasound. They have to go through mammography, and nobody really wants to go through that.
They have to go through mammography first. If they have anything that's unusual or abnormal, then they would get an ultrasound. Excuse me, but ultrasound's not great or not as good or not as well recognized as an initial screening tool.
Well, I don't know anybody who will really rush and look forward to that kind of examination. You know, very briefly, to just say why to choose Dr. Peter Lennox. You know, I found so much about you, what you do. You are also teaching. You know, yeah, I can see how this is not easy for you to. When somebody talks superlatives about me, I don't like that either. We can find more about Peter Lennox again on Peter Lennox, drpeterlennox.com. Other questions, I guess I will have to ask you when we're without the cameras, because we don't have more time.
Okay.
Time ran very fast. Thank you again. I'd like to ask you for the signature on
my pleasure.
The sixth cup for the sixth season of the VMEA Cup.
Thank you very much.
If you're interested in more about Peter Lennox, again, I mentioned his website, drpeterlennox.com. Otherwise, I'm going to see you again next time.
Thank you.
Thank you.